Hello class, this is Nicole Alsacher. I will be doing a narrative audio supported musculoskeletal PowerPoint for you to listen to. Make sure you have your packet and your worksheets along with the slides so you can follow along and take notes. And again, always refer back to your book if you have any questions or if you didn't catch something. Also, please do write down anything that is unclear during this presentation, so you can definitely ask me in class when I see you next. Okay, so musculoskeletal system, it provides structure and movement for our body. The nervous system also plays a huge part in the musculoskeletal system, and again we'll get into the neurosystem next week. Musculoskeletal system makes up of our bones, muscles, and joints. So again, primary function is for our skeletal movements. There's different types of joints. There's fibrous joints. Those are immovable. Those would be things like the sutures between our skull bones. I'm not going to get too much into the A and P. Just kind of making sure you go over what tendons do and how the joints move. Okay, structure of the bones. This should all look familiar from A and P. The number of bones is 206. Purpose of the bones is for structure. They give us protection. They store calcium and produce blood cells, and they act as a lever. The two types are compact and spongy. Skeletal muscle movements. You will need to know the different types of movements. So this, again, should look familiar from A and P. So adduction, abduction, flexion, supination, all of that should look familiar. You should be able to define what those movements are and be able to demonstrate those, and also like give an example of what type of joint can do extension and flexion and how you would adduct something or abduct something. So look at that. There's pictures in your book, and there's a next slide that goes over some of those. They help us with our skeletal muscles. Skeletal muscles help us with our posture. They produce body heat, and they allow our body to move. Tendons attach muscles to bones. So again, looking over at some of the movements, these are just some of the examples, but again, go through the list. In your worksheet, I believe it's question number 1 under musculoskeletal, it asks to make sure you can define those movements. Speaking about our elderly, things regarding their musculoskeletal system is that they obviously have a little bit slower movement, reduced flexibility, decrease in muscle strength. You might notice some posture changes, a decrease in height. One of the disease processes that fall under musculoskeletal is that bones lose their density with age, and that puts them at risk for osteoporosis. I believe there is a section in your book on osteoporosis, so just go ahead and review that, kind of knowing what it is, what some of the risk factors are, and some of the teaching topics you can do with osteoporosis. When you move into the physical exam with the aging adult, kyphosis is common. You're going to have just kind of a change in their overall contour. You're going to see a decrease in fat in the periphery, so like their arms and legs tend to get a little bit skinnier, but they may have more fat deposits around their abdomen and hips. And their bony prominences become more marked, and again putting them at increase for pressure ulcer. So when we talk about the musculoskeletal system, the main thing you're going to hear are pain and limited mobility. So you want to find out, using cold spa, what type of pain they're having, what makes it better or worse, onset, and how it kind of affects them. But typically the two problems you will hear someone complain when they talk about their musculoskeletal system is pain and mobility. Moving to our subjective data, again, you're going to find out what brought them in, find out about their past health history, find out about family history. kind of their lifestyle, health practices, what do they do, and then also if you can just get kind of an assessment of their ADLs, you can get a lot of their information just from this. So again, some people don't know, you can't just say, hey, how are your ADLs? They won't know what that is. So you'll be like, do you have any trouble getting up and going to the bathroom? Do you have any trouble doing, housework? Are you able to get dressed? Can you button your shirt? Can you bend over and tie your shoes? Those type of things. That will give you a lot of information kind of about their musculoskeletal system. When you go to actually kind of examine, again, finding out about their ADLs, screening for abnormalities, and also watching their gait, you can gain a lot of information just from those. This is the scale we will be using to grade one's muscle strength. It's kind of a way to talk to other healthcare professions about what is kind of a normal strength, because again, we don't like to chart, they had normal strength. So we can use this scale. It's on page 518. So again, 5 out of 5 would be like a normal strength. 4 out of 5 would, what we would call like, maybe some slight weakness. 3 out of 5 was they can move it against gravity, so they might be able to raise their arm up, but if you push against their arm would fall back down. So that's what we say when a 3 out of 5, movement against gravity, but not against added resistance. 2 out of 5 would be movement at the joint. So again, if they maybe had, if you said their right arm was a 2 out of 5, meaning they might be able to shrug their shoulders or kind of move their wrist, but they weren't able to actually lift up their arm against gravity. A 1 out of 5 would be visible muscle movement, but no movement at the joint. So that might just be like they might be able to kind of grip your fingers a little bit, or they might be able to kind of move their fingers, but that would be it. And then 0 out of 5 would be no movement. The main assessment tools you will use for musculoskeletal is inspection and palpation. There's no percussion and there's no use of a stethoscope during a musculoskeletal exam. The things we're looking for, and this pretty much applies to all joints, is when you inspect, you're looking at the contour, the symmetry, the size of it. You can inspect the color if you notice that something's kind of red and inflamed. Also, when you're asking them to do range of motion, you're inspecting. You can palpate for pain, tenderness, if the joint feels warm, for any kind of crepitatious, and obviously if there's swelling and things like that. You can apply these to pretty much all of the joints, so therefore I'm not going to go into neck, spine, elbow, hands, because I would be repeating myself on each of those. These are the assessments we're going to do for those. So, talking about the spine, there's some abnormalities. You could see a kyphosis, you could see a scoliosis, you could see lordosis, and a flattening of the lumbar curve, which I go over those in these slides. So, the first one here would be like our normal spine. This is kyphosis. This would be lordosis, and this last one here is our scoliosis. The only one I don't have pictured here is a flattening of the lumbar spine. So you see how we typically have a little bit of a curve in our lumbar area? Well, someone who's had a herniated disc or any type of fusion in this area, you're going to lose that curve. So you're just going to kind of have a flattening of the lumbar. Here's just definitions of what I just went over in case you need further clarification. Then you can move into the arms. So again, we're looking at their wrists. Things you might look for would be something like carpal tunnel and the Fallon's test. So the Fallon's test is where you're going to take the dorsal side of one's hand, and I'm sorry for my drawing, and that person only has 4 fingers, but that works. You're going to put the dorsal side of hands together. There's their arm. Okay, so you're going to put those kind of back to back, and this would be touching here. And you get to do this in lab, so hopefully my picture kind of gives you a general idea, but you actually get to do it in lab. So that's the Fallon's test. So we're going to put those dorsal side of the hands together. You're going to hold it for 60 seconds, and we are looking for pain, numbness, and tingling. Here's just a couple of quick pictures on how you can do push-pulls on lower extremities. You can actually do push-pulls on one's thighs. So if they're having like maybe some lower back pain, maybe sciatic nerve type pain, and they're saying that their leg is kind of weak, you could check their thigh on what their strength is. You can move down to the shin area, and you can do push-pulls here, and also do them on their feet. So we can do push-pulls as well. There's lots of different areas where you can assess push-pulls. The one thing I want you to do is be consistent on how you're assessing them. So if you're assessing their thighs push-pulls, you know, and you come back 2 hours later and assess again, you have to assess the thigh again. You know, you can't just jump down to the feet and not follow up. And so you need to be consistent in your charting and just make sure you document where you assessed one's push-pulls. Here's just a chart I want you to review on the differences between rheumatoid arthritis and osteoarthritis and what some of the symptoms are for each. Abnormalities, again, here's a picture of rheumatoid arthritis. Typically it's in both hands, in both joints. Again, here's my slide on osteoporosis. Please review that. Some of the non-modifiable risk factors, we can't change one's gender, their age, their body size, their ethnicity. And this time, remember how we talked about abbreviations and we talked about RA? In this case, the RA stands for rheumatoid arthritis. The modifiable risk factors, here's where your teaching can occur. These are things that you can teach on. And as you are assessing someone and doing a health history, if someone is female, elderly, thin, white, has been through menopause, has rheumatoid arthritis, smokes, doesn't exercise, these should all be red flags for osteoporosis. There are a ton of abnormalities. I'm not going to go through all of them. On your worksheet, there are abnormalities of the shoulders, so you should be able to describe what happens, what assessment findings, and where their pain is and how their mobility is. For these, elbow, there's just a few. You don't need to memorize those. For the knee assessments, you don't need to memorize all of these. If they're on their worksheet and there's something kind of we talk about, those would be the ones that you might see again. Again, abnormalities of the ankle and foot. Here are just a couple of pictures. So this would be our hammer toe. This would be the Oscar Slaughter's disease. This would be a dislocated shoulder. This would be gout. Ingrown toenail, a flat feet, and these are plantar warts. So again, just a couple of pictures to kind of show you some of the abnormalities that you might see in the musculoskeletal system. If you have any questions, please write them down and bring them to the class next time we meet.